Okay, so let's go over the Centor criteria for sore throats. So I'll explain what the Centor criteria are, or what the group of criteria is, and how I've used it in my career. By the way, I'm a PA, or physician assistant, which is similar to a doctor. And I've been working in the ER for like 10 years, and I've done some urgent care and family practice as well. So what are these Centor criteria? Well, basically, there are some criteria, 4 or 5 criteria, depending on the age of your patient, that will tell you how likely it is that their sore throat is caused by strep throat. In other words, is it caused by bacteria, which might need antibiotics, or is it caused by something else that doesn't need antibiotics, which is usually a virus? And by the way, most of the time it's going to be a virus. Most sore throats are not from bacteria. So what are the criteria and what's the significance of it? So I'll start with the basic criteria and leave out age. Age is another part of it. My first ER job was actually in an adult emergency department, so I just ignored age back then. So I'll kind of explain how it is if you don't have to worry about the age, and then I'll explain how it is if you do. I guess it does apply. The age does apply to adults, and I'll explain that in a second. All right. So the 4 basic criteria are so let's start from inside out, I guess. So on the inside, you'd look for exudates, which means like white pus on the tonsils or in the throat. So you look for the exudates. Then you might have some tender cervical adenopathy, tender anterior cervical adenopathy. So tender lymph nodes on the front of the neck is another one. And then the cough, if you do not have a cough, that's a positive criteria, meaning you're more likely to have strep throat. So it's called absence of a cough. And then the other one is fever. So those are 4 criteria. So you can get a maximum of 4 points, obviously, with that. But then you can also use age. Now, anyone between the ages of 15 and 44, age doesn't change their score. But you get an extra point. You're more likely to have strep throat if your age is between 3 and 14. And you're less likely to have strep throat if you're over 45 or 45 or older. All right, so that's how you get the points. 1 point for exudates, 1 point for absence of a cough, 1 point for tender anterior cervical adenopathy, 1 point for a fever, and 1 point if you're between the ages of 3 and 14, I guess. 3 to 14 is the range. All right, so if you have 0 criteria, don't worry about strep throat. What if you just have 1? So, for example, somebody, they have a cough, but they don't have a fever. They have a sore throat, and there's a couple white patches on it, but no fever, no cough, the neck's not tender, and they're in that 15 to 44 age range. So they only get 1 criteria. So what is 1 criteria? 1 criteria says 5% to 10% likely to have strep throat. So it's very unlikely, don't do anything. Let's say instead of just exudates, now they have exudates and tender adenopathy. Now we got 2 points. So that's about 15%. I'll just round it off. 15% likely to be bacteria. So my interpretation of that is don't do anything. But if you really want to, you can do testing. It says optional testing. What if you have 3 points? Then the likelihood goes up a little bit. So say that same person also has a fever. The likelihood goes up a little bit to about 1/3, about a third chance, like 33%-ish. So 3 points equals 1/3 chance. So then like the official thing will say, it'll say, yeah, about 1/3-ish, and consider testing, consider rapid testing. So my approach in my first job was if they got up to 3, I would kind of talk to the patient and make a shared decision with them about treatment. And if they got up to 4, we would treat. And we didn't do any testing there. At my current job, we do testing sometimes. So that's my approach is like, if they get up to about 3, then I'll test. If they have 4 or 5, I'll test and maybe even treat empirically but we don't really have to do that because we can just wait for the test unless they're in a big hurry or something, because the test only takes like a half hour. So if you get up to 4, it's about a 50% chance of being strep. So for example, if you had a kid who's 12 years old, so they get 1 point for age, and then they have the exudates and the tender adenopathy and the fever, then like I said, it's about 50%. and it says consider rapid testing and empiric antibiotics may be appropriate. And then if we get the fifth and final point, it says it's still about the same likelihood as 4 points. That's interesting. And then consider testing and empiric antibiotics. So 4 or 5, it says maybe empiric antibiotics. Anything less than that, no. But sometimes you might make a shared decision with the patient. And then, 3 points is 1/3 chance, 4 or 5 points is about 50%. A couple just final thoughts on that is it's interesting that, by the way, little kids are very unlikely to have strep throat under about 2 years old. So that's why it says 3 to 14 years old are the ones that are more likely to have it. But the little kids, not likely. And older adults are less likely. That's kind of interesting, like over 45 years old, 45 or older. Also, the one I love the most is absence of a cough, because the thing is, the more symptoms you have, like runny nose, cough, sore throat, if you have all those symptoms, it's almost never strep throat, because strep's not going to cause like a bunch of respiratory symptoms. It actually sometimes causes like GI symptoms like vomiting and stomach pain, and especially in kids, but it's not likely to cause a runny nose or a cough. So it's interesting that, once you have all these symptoms and you feel miserable and you have all the flu-like symptoms, it's probably not strep throat. So I don't even bother testing or bringing it up on people where it just seems really unlikely in that scenario. But yeah, if you don't have the cough and you do have the sore throat and you don't really have the runny nose, then it makes more sense to consider strep. So those are some kind of interesting points, or the way that I think of it. So that's the Centor criteria, really useful to know about if you see a lot of patients with sore throat like I do, and hopefully that'll be helpful. Obviously not medical advice, because nothing I share online could be individual medical advice. I don't know you, I don't know your circumstances, but that's it for this video.